Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome into another episode of the Medical Collective, and I am your host, Dr. Keisha Davis, pathologist, trainer, and mother, and so much more. But today I'm here to speak to you about something that's been in the headlines, but I want to kind of put it into perspective for you all and do a little bit of a teaching moment. And that is about what hantavirus teaches us about other viruses. And we're going to go back to biology class for many of you all, but I think it's important because when we hear that there is a respiratory infection, we think, okay, what does that mean to us? I'm healthy, so therefore I'm good. Or I'm not healthy, so what is going to happen to me? What can it do to my body? So I'm taking you on the magic school bus into our body with viruses. One of the infectious diseases that can affect us. And we have bacteria, we have parasites, and we can talk about those things another time, but today is viruses since hantavirus is in the news. The hantavirus is usually divided into the old world and the new world. The new world viruses are the ones that usually affect us in the Americas and South America, what have you. The ones that you see in Europe and Asia, those are considered the old world viruses, and they infect the same type of cells, but different parts of the body. So that's why I'm like, you know what? Let's talk about viruses and what they do. So most of you guys may think that viruses are those that cause respiratory infections or the cold or the flu. But viruses affect the body in different ways. These recent conversations that we had about hantavirus, again, are why I want to dive deep into it. Why are some viruses mild? Why do others cause cancer? Yes, some cause cancer. Why do some cause paralysis, organ failure, or affect your body many years later? And why do some barely affect one person while another person ends up critically ill? So I'm going to walk through what viruses actually do to your body from a pathology and public health perspective and what this hantavirus is teaching us. So before we get into how they behave differently, I want to start with what a virus is. Many of you know that we are living organisms. Bacteria are actually living organisms, but when we get to viruses, they are not fully living. Yeah. You know, they cannot live on their own. They have to live within another host, but within their cell. They cannot reproduce independently. They have to enter our cell and hijack it, basically. It's like a takeover. They come into your body, into your cells, and take over your cell. Your cell has the capability of multiplying, right? Mitoses and replicating, but the virus needs our machinery. It's like they have part of it, but they don't have everything. So they have to come in and take over to be able to replicate. And different viruses have their own homes. I've described before the Goldilocks situation with viruses like HPV, but many viruses may choose different homes, but they have a predilection. And a lot of it you'll hear about has to do with how the virus is made. Some can have armor, like a capsid that's doubled up. Some can have a tail. Some are sleek or more able to evade the immunity, should I say. So that depends on where a virus wants to live. That also makes up and predicates how they're going to navigate an immune system. But viruses, when they get into your cell and they replicate, they damage your cell. That's the basic point, but they can damage it and cause havoc in different ways. For instance, we first know that when a virus goes into your cell and hijacks it, it's like someone coming in and demolishing your home in a way. or having a party they shouldn't be having there, and they mess it up. You can tell that there's damage been done. Viral cytopathic effect is the effect or changes that happen from a virus. When I look under the microscope, for instance, HSV, which is herpes virus, if you ever have a pap smear, the changes that I can see under the microscope are that your nucleus, which is the powerhouse of your cell and is one, well, the virus causes it to look multinucleated, or multiple little circles representing the nuclei clustered together and causing this cleared out appearance. And it's very characteristic of herpes, to where you do confirmation, but when we see it, we're like, that's herpes virus. It's very characteristic. Of course, we'll do confirmation with immunostains, but it's herpes virus. CMV is another one that has a very characteristic. It makes like a halo, a punched out halo. Some viruses have an appearance of a giant cell. Some viruses have what is called an inclusion. It's a little inclusion body that you can see even in the cytoplasm, or a nuclear inclusion, or both in some viruses. So all of those things are key indicators of a virus coming into your body. And again, where they come into the body depends on the virus. Now, when it takes over your cell, eventually your cell can't survive anymore, hence it dies. But you know what happens after the cell dies, or if it takes over? Your body has the police come out, the ambulance come out. They realize that there's problems. Now, if you had a fire and the fire department came and started to hose down, right, the fire, and they had to break down the door to get in your house, there's going to be damage. So our immune system does cause its own damage when it's trying to help out. It's just what it is. So the inflammatory cells that come in, the inflammation can cause damage. The tissue destruction around it, right? Maybe the fire was just in the kitchen, but now they had to go through the front door. That's messed up. They were spraying everywhere. The living room is now messed up. So there can be adjacent damage because of the virus and your immune system trying to help out. HPV is one of them that it affects the certain mucosa called the squamous mucosa. Now, all of our organs have a lining. It protects it. Our skin is a line, but it's called epithelium. Our skin is a squamous epithelium. But inside the mouth, the anus, the vaginal area, all of those have a squamous mucosa. And the HPV virus likes to go to that home. So when it causes changes or damage, it's happening to squamous mucosa, depending on where it decides to reside. The liver. What viruses happen in the liver? The hepatitis viruses. Hep A is acute. Hep B and Hep C are chronic hepatitis. They affect the liver cells. And what do I see under the microscope? I can see viral cytopathic changes because it's affecting the cells. But I also can see inflammation that happens. And that's your immune system coming in. And it's usually the lymphocytes that come in and try to help out. Same thing with in your mouth, the respiratory viruses that happen, like the rhinoviruses. They're going to affect the airway epithelium. That's what they like. That's their home. That's what they like to choose. So a virus, when they go in, they're using your own cells to make copies of themselves. They don't have their own machinery, so they come in and take over yours. That's the only way they can survive. So you may ask, why do they affect the body so differently? Why do they affect me differently than they affect my friend? Or why does this virus not do what this virus does? It's because their genetic makeup is different. And the way I can categorize some of them is respiratory viruses, for instance. Your upper respiratory system is your nose, down your trachea. Now, there are viruses that like to just stay up there. They don't go all the way down, right? Down your airway into your bronchuses and your right and left lungs. Those are your lower respiratory. That's your lower respiratory system, and that's where lower respiratory infections occur. But the upper respiratory system, which you have the coughing, right, and the congestion and all of that, that's rhinovirus. Those are your seasonal, what we call coronaviruses. Have you heard of those? Adenovirus. Those are the upper respiratory viruses. Now, when you hear about viral pneumonias or you're really, really sick with the fever and out of it, that's where flu happens. And the flu, the true flu, the respiratory flu is influenza viruses. C19, COVID-19 is a lower respiratory infection, among other things. RSV as well can be an upper, lower respiratory. And then the one that we hear about now is hantavirus. Now, hantavirus can cause a hantavirus pulmonary syndrome. And the reason why hantavirus can be different is depending on if it's one of the strains of the old world or new world, is that we've seen that the new world viruses, and similar to the one we're going with, likes to go into the lung and the heart, so the cardiorespiratory system. Now, the cell, here's the thing, the cell that they like to bother is the same. Take a straw and pretend that a straw is a blood vessel, right? It's the highway through our body where blood travels and helps with oxygen, nutrients, everything. Now, the inner portion of the straw, it has a lining, and it's the endothelial cells. Those are the cells that allow in our body for the lining, quote, of the straw to stay intact. Have you ever had a drink and you've noticed that there may have been a tear in the straw, and you all of a sudden that shake or that smoothie you want is just not coming up? You just can't get it. It's because it's been damaged. And the endothelial cells, if they're damaged, they become leaky. So they're not efficient. The blood isn't going through, it's leaking out, and fluid is leaking out, which can cause in the lung edema. So that's why people that have hantavirus or other respiratory viruses of the lungs, the respiratory system, they can, if it's very severe, get an internal or a pneumonia, that's a viral pneumonia that we call interstitial, or they can end up having fluid go into the lung air spaces. And the air spaces, it's like a honeycomb. You want those spaces to stay open and dilated because that's where the air exchange happens. And if fluid is in there, that's a problem. So hantavirus is one that can do that. Now, in the old world, the hantavirus still affects the endothelial cells, but it seems to affect them in different areas, hence the kidney, and also your vessels itself can cause a problem because you can get part of the hemorrhagic fevers. So it can present as a hemorrhagic fever where you're anemic, where the cells that you need to fight also to prevent bleeding, the platelets are decreased. And it also can damage the endothelial cells that are in the kidney. So just depending on which strain, it's affecting the same cell, but in different parts of the body. So that's the hantavirus. And also, depending on how the makeup of the virus, that's why they like to either stay in the upper respiratory and just chill out, right? They're not maybe, it's kind of like if you're choosing characters on a game, right? The fighting games, there's one character that may have better endurance, another one that's stronger, another one that can live longer, right? That's how viruses, they all have their plus and minuses. Then the respiratory viruses that like to go down low, they invade deeper in the lung tissue for some reason. That's it. So a bit about hantavirus while we're here, why they also affect people differently. Hantavirus, out of everything I've talked about, is actually zoonotic. So usually it's an infection of animals and rodents. But we do see that some of the strains can affect humans. But usually we get it because we are exposed to the droppings, the urine of these rodents. We breathe it in, and then it goes wild. And depending on, again, the new world is supposed to be more virulent, meaning it's more toxic. It's stronger. It can cause a more severe infection. Hence why more people can unalive from it, because it has a mortality rate of sometimes 40 to 50%. It can be more severe. So depending on strains, even one virus can mutate. And we've seen with COVID where some types of COVID were more severe than others. Now we're dealing with one that spreads more, but it's not as virulent as some of the others. I hope that makes sense. And that's where we are with the hantavirus. Again, Cardiopulmonary syndrome is one of them, and the New World virus for hantavirus, the edema, remember that pulmonary edema. And at the end of the day, it's injuring the cells that line your blood vessels, the endothelial cells. All right. Now, let's get on to another region of viruses, another set of viruses that like to go to the liver. That's your hepatitis. And it's basically the alphabet. A, B, C, and E is where I'll stay. There's a D, but the hepatitis A is acute as well as E. They can be associated with travel, foodborne illnesses. B and C, though, we know there are certain ways you can get that. And that's not transmitted by breathing in, changing of fluids. Those who, there was a time period, even people were getting it from blood donations. Those that may be sharing needles, things like that, you can get hepatitis B and C. So that's very important. And they can cause this acute infection, which is okay if it resolves. But the chronic infection, the problem is that over time, it damages your liver to where you can have cirrhosis or end up having cancer. Yeah, so there's a risk. So actually, hepatitis viruses can cause inflammation, but they also can lead to cancer. Then you got the viruses that like to go to the nervous system, or what we call neurotropic. A couple of examples, rabies. And I know we don't like to hear that, right, when we think about the rabies virus and staying away from bats. And you would be surprised how many people have seen a bat and didn't think about not picking it up. And they proceeded to do things that were risky. West Nile virus is another one that is neurotropic. Poliovirus, which basically should have been eradicated by now, but we still have people that are getting it, especially as immunization rates are going down. The complications of measles goes in the lung, but measles also can be neurotropic. We heard one of the most severe things that could happen with acute measles is encephalitis, and it can cause a long down the line encephalitis as well, or encephalopathy that I'll talk about. And there's another one too, JC virus is one that likes the nerves, so they're neurotropic. If they involve the lining of the brain, encephalitis, or even the meninges, you can be paralyzed, right? And encephalitis is not good because your brain needs to function to breathe, to think, all of the things that we take for granted that happen. And people can die from encephalitis. They can die from it, yeah. Then there are viruses that I think are let's say it like having an infestation in your house. You may not know about it for a minute. They're the unwelcome visitors that kind of try to hide out of sight until you realize they're there, like termites, basically. Oh, termites. That, I would say, would be HSV. HSV herpes 1, HSV 1 and 2, yes, they can present originally like with a sore. HSV 2 is usually known to be right, or 1 and 2 are known to be either the sores or genital, but you can see they can interchange. But sometimes what happens is you may have not, especially in men, they may have not seen the sore. So later, when they're stressed, sick, they present with, because the virus stays in your nerve cells, it can come out later and present as an infection. It can be a painful infection, later. So that's HSV. Varicella as well, which we know why many people are getting the shingles vaccine. Epstein-Barr virus as well. We have known people to get sick with infections, and then later they have an autoimmune disease or something, and then studies show that it was linked to a prior viral infection. Yeah. They like to stay, and it's called latency. They go into a part of your spinal cord called the dorsal root ganglia, and they hide out. And then when they realize, oh, the coast is clear, or your guard is down, hence you're stressed, whatever, they come out and they reactivate. That's what shingles is. Yeah. I mean, not what we want to have or hear about, but unfortunately it happens. Now, you would ask me, as we look at hantavirus, as we look at other ones, which scares us are the ones that cause death, right? Or cause hospitalization, or just ruin everything, like norovirus. You go on a cruise and all of a sudden everybody's sick because they didn't take precautions. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Now, my husband cooks, and I am tying this in. You're going to ask, why are you talking about your husband cooking right now? Because I want to talk about a recipe, a good recipe and a catastrophic recipe. My husband made jollof rice for my birthday, which was last week, and it was delicious. And it was a vegetable jollof rice, right? Now, the thing about like good recipes is there are ingredients in there that you may not even know are in there or taste them or recognize them. But if they were missing, it wouldn't be the same. And he had everything in there that needed to be in there. It was the perfect recipe. But a catastrophic recipe is one that can lead to a global threat. That's when public health is scared. And you may ask, well, what makes the perfect recipe? It's when all of the things about a virus are right in place, and then the timing, and then our response does not match up with it. That's when it's catastrophic. For instance, the first ingredient that is needed for a catastrophic recipe is transmissibility. That is, how easy can that virus spread? And you want to know examples of some that are very transmissible? Measles virus. COVID at one point, and still is, very transmissible, meaning that the virus can even linger after you leave the room. The Hantavirus, I want you guys to know, even though there's human-to-human spread, which most of the viruses I'm talking about, there's human-to-human spread, that the human-to-human spread requires prolonged, extensive contact. Not like measles. Did you know that for one person that has measles and there's 10 people in a room, 9 people can get it that aren't vaccinated? And do you know that hours after you leave, maybe on a plane, the measles virus is still there, ready to find another host? Yes. So that is the difference between the two. That a virus can be very transmissible and not as much. And the thing that hantavirus, now that's the one part of the recipe that hantavirus doesn't have right now, is that it's not very transmissible. So that's a good thing. That's the part of the recipe that we don't want. All right? And also airborne, which we say airborne is meaning it can stay in the air. An air droplet means, for instance, if somebody coughs on you, literally coughs on you, and the air droplet is there, and then you get it. That's different than saying it's actually like airborne. And then contact, meaning it requires actually touching, contacting, or somebody has the herpes virus, you'd have to literally touch that vesicle or something. If you remember, herpetic whitlow was when caregivers or someone taking care of a baby would have a little vesicle there and not realize that it was the herpes virus, and they would change the baby and the baby would get it. So that's contact. But the perfect recipe is when it's easy to transmit. So to me, the perfect recipe would not be contact. It would not be droplet. It would mean that the virus could just be in the air, airborne. So we don't have that one with that. Now, number 2 ingredient is virulence, meaning how strong this is. Meaning the healthiest of people will get this virus no matter what. It's that devastating. It's that powerful. How serious is the disease? Even in the most healthy people. And we know with hantavirus, unfortunately, it has that ingredient. With the New World virus and the one that's spreading, having a mortality rate of up to 40 to 50%, that's severe, you all. The mortality rate of COVID virus is nowhere near that. Nowhere near that. Examples of very virulent viruses are Ebola, hantavirus, and rabies. And rabies is scary because people that get that sometimes don't know until they exhibit the symptoms and it's in the brain and it's too late. It's too late. All right, number 3. This one kind of goes with the other ones, but this is an ingredient that's needed. It's an immune evasion. How the virus can hide or manipulate your immune system, right? So this actually, hantavirus has this one too. And the reason I tell you why is that the incubation period is long. So say, for instance, you get an infection and within 5 or 6 hours, you know you have it. It's easier to contact trace. It's easier to sequester you, seclude you. But if you have a virus and for 42 days, up to a month, you can hold on to it and still spread it, right? Or end up not knowing until it's too late that you're very sick and nobody can help you. That's more serious than one that can evade like that. So that's something actually the hantavirus does have. So immune evasion. Other things that have immune evasion are HIV. And if anyone remembers, and I was alive during part of the HIV epidemic, is that people didn't know they were sick. So if a virus is able to evade the immunity for a while and then wreak havoc to where it's too late for you to respond to it, that they have done, their mission has been accomplished. Now ours is not. Herpes is another one because herpes can go latent, like I mentioned. Once you get it, you have it for life. You may never have symptoms because it could just stay in your dorsal root ganglia, as I mentioned. Measles is another one. Measles evades our immunity. And I explained this, go listen to the episode on it, by causing immune amnesia. So this one is actually worse than the other one because this one is almost described as a cult. It is able to brainwash your immune cells so it forgets other vaccinations you have had. It can cause amnesia to where you do not remember that you were immune to other viruses, bacteria, what have you. So all of your memory, if you were exposed to things as a child, a lot of infections, right, and your immune system is built up, measles can wipe that out. So that one is serious. So the third ingredient is immune evasion, suppressing your immunity, staying in your body forever, causing a chronic infection. Those are all things you don't want, but that's something that a virus wants. All right, the fourth ingredient for a disaster that a virus would need is what happens with the immunity of everybody. Now, first of all, it's important for people to understand for the viruses that have vaccines, and hantavirus, this is actually something that is not good for us, but good for hantaviruses. Right now, there's no vaccine for it. So if a virus is able to be around for enough to where they're like, okay, no vaccine can be developed. Now, it can be hard to develop one if the disease is sporadic or people unalive from it fast, right? To where it can take longer to develop a vaccine. So there's not a vaccine for hantavirus, but many other ones are. So if people aren't uptaking it as well, that can be a problem. You've heard of herd immunity, and herd immunity is that at least we have a certain amount of people that are protected, that are immune to an infection and can protect others that can't protect themselves. It's not meant to say, okay, I'm not taking it, I'm not taking the vaccine, and just assuming everybody else is taking it to protect you. It doesn't work like that. In addition to that, there are some viruses that you can't afford to wait for herd immunity when everybody is sick right now. You remember during COVID, we can't afford to wait for it when we had 1.1 million dying from it. So that's something to take into account. And why outbreaks happen is when immunity drops. So that's a recipe, another part of the ingredient that makes a recipe for disaster. All right, the fifth ingredient is environment and location. Measles right now, if you're not checking the maps, another outbreak in Ohio, if you're not checking to see where outbreaks of measles are happening and you happen to go to that area and not be immunized or you have a newborn, that can be dangerous. So it's important to know your environment. Look at the local health department, see what's going on in your area. You're traveling. People do it all the time, especially if you go to a travel clinic. They'll tell you what's happening right now in the place that you're traveling to. It's important. Rodent exposure too. The couples or the people they believe that may have gotten it. Now there's two stories, by the way, they haven't confirmed it. We're off the ship in a certain area and they believe it has to be a closed quarters, by the way. I know there was these people that were bird watching, they believe, but supposedly that hantavirus has to be usually transmitted in a closed location for a prolonged time. So like in a warehouse or a building and you're breathing in the rodent droppings or urine. Yeah. So environment matters. The climate matters. As we see climate change, some infectious diseases that happen in certain parts of the world are now traveling. Wastewater surveillance is important too. If you look, the wastewater surveillance actually caught the rise in measles cases in a location 2 weeks before people started going to the ER and the doctor. Yes. So wastewater surveillance is actually on our side. So if we do the public health measures and we fund and we trust the experts, we actually can knock out this ingredient for disaster by understanding location and where you are getting infectious diseases from, warning the public about it, understanding also mosquito vectors that can give you hemorrhagic fevers or malaria, right? And doing the protection, telling them about DEET, telling them about the things they need to do if they're going to the area with those type of mosquitoes, and understanding travel patterns. So important. So communication and having a core team. And at the core of that team, for the recipe disaster to be knocked out, is having a solid CDC. And we have lost over 10%, a big chunk actually of our staff and the head. Not having a head of departments at times, losing the CDC director, the one that was doing amazing, and not having a lot of experts that were there and leaving as a problem. Because what has been said, and I know I was listening to the CAP, the CAP, which is the College of American Pathology, and some other groups were having conversations about this. And one of the things that has happened was the response here in the United States was a week after everybody else found out about the outbreak, when WHO and other countries were already pulling their people out and doing the right thing, that we were delayed by a week with our response. And that's a problem. And that comes to the next ingredient for disaster that we don't need, that the virus needs. And that is human behavior. That is human behavior. So this is what I'm going to say. It's the same thing as people posting online that they're going out of town and the bad guy is waiting, has your location, knows where you live because you post all these pictures of your home, and they come in and catch it because you have shown your cards. We cannot show our cards to the virus. We have to continue to wash our hands. So simple, but let me tell you, as a person that travels sometimes 2 to 3 times a month, that people are not washing their hands in the restroom. They are not. So that's a bad recipe for disaster. We have to have good hand hygiene. When we are on these cruise ships, the norovirus is waiting for you to touch that door and touch your face or touch the utensils at the buffet. So constant washing and knowing that hand sanitizer alone is not going to help with norovirus. You have to wash those hands with water and soap. Masking. If we are traveling, and you can ask, if you ask the doctors, especially pathologists or people in infectious disease and surgery, what have you, they're masking when they're in public, especially in airports or flying in large areas, maybe at the mall or wherever you are, they're still masking. And especially now, if you're worried about hantavirus, masking would not hurt at all. Vaccine uptake is another human behavior. People have declined them now, and the virus knows that. Hence why measles, which for 20 years was subdued, is now coming back. And we should be, and probably will lose our elimination status. And what that means when we lose our elimination status is that the virus that we have contained through vaccinations has no longer been contained. We have seen it enough in an outbreak to where it's called losing elimination status. And we'll be number 3. Right now, 2 places already have lost theirs, but we could be number 3 by November. Yeah. Another human behavior that's a bad ingredient for a recipe for disaster is misinformation and delayed care. Misinformation, because I believe as the misinformation spreads, people delay their care and they go too late. If you're in respiratory failure, if you wait too late, you're not going to be able to be helped on event. Not at all. So infectious disease isn't just biology, it's interacting with human behavior. So let's not make that recipe for disaster. Let's make my husband's recipe, but not that one. So when a virus causes damage versus the immune system is something I want to touch on briefly. The virus comes into the body and can damage your cells, but the immune system, our immune system can even by trying to help, can cause damage, but also the virus can trigger our immune system to almost have an autoimmune response. Okay? For instance, direct injury by the virus is like the liver destroying the liver cells, and hepatitis. Rabies destroying the nerve cells. That's neuronal injury. That's direct injury of the virus. The hantavirus destroying the endothelial cells that line your blood vessels. Those are directly killing the cells. What actually happens is what we call apoptosis. The cell dies, and then the surrounding tissue gets destroyed. So immune-mediated, for instance, is a virus comes in, and your body, your immune cells, they also like to think about it like darts. They like to release things, and they're called cytokines. And those cytokines can cause a cytokine storm, which is not good, and can lead to damage. And your whole body can be affected by it. For instance, also COVID. COVID itself did go into the lung and cause destruction, but we saw is that somehow the immune mediators that were released from our immune system with the help of COVID led to a clotting phenomena. We saw clots. We saw them in the lungs. We saw them in the brain. We saw them in the placenta. So that's an immune-mediated response or injury. Something else that happens, the long-term, long COVID, or in children, MIS-C, immune-mediated response. And many viruses have what's called a post-viral syndrome. That's immune-mediated. The immune system can be overactivated and cause collateral damage. That's what it is, collateral damage. Yeah, so it's important to know about that too. Now, some of these viruses don't just cause damage, they end up causing cancer. HPV is directly the cause of cervical cancer. The majority of people that get cervical cancer is due to high-risk HPV, which is why cervical cancer screening is so important. And we have an episode on that. EBV is another one. HHV8, hepatitis B and C, all of these can cause cancers, from Kaposi sarcoma to lymphoma to liver cancer, all of them. The inflammation over time, the DNA, the material, genetic material from the virus can lead to this oncogenic response that turns on the cell and leads to cancer. Yep. Some of the things that we see under the microscope is we see the pre-changes of it. We see atypia, we see dysplasia, and then we see the frank cancer, right? And we see that with cervical again, with anal cancer, head and neck cancers, all of those things. And that's probably the most dangerous thing that with any virus we don't know about. We don't know its potential to cause cancer. So while you may say, I just got COVID, and we don't even know the potential that COVID can cause to cancer because we haven't gotten that far to look into it. Any virus you have over time, because it can stay in your body, long-term inflammation can lead to changes that can lead to cancer. That's the gist of it. Now, this latency thing is interesting. A virus coming into your body and just hanging out for a while. As I mentioned with some of the neurotropic viruses. That's one of the most fascinating things about them, is that it doesn't end when the infection ends. You think your acute infection, for herpes, for instance, you have the bumps, they go away, you're done, but it can reactivate later. Shingles with the varicella is one of them. Measles. The saddest story, and I've shared this before with the measles episode, was the child who, the 2 months before they get the measles vaccine, the baby was exposed to measles, got a measles infection, but got better. And now in adolescence, the child died from subacute sclerosing panencephalitis. Over 5 years later. That is what happens. The virus is gone. It's not an active infection. So this is immune response that happened. These are the things, again, why we need to prevent people from getting infections sometimes and nip them in the bud, because we don't know the consequences that are going to happen many years later. And I've also mentioned this before with what we call post-viral syndromes, people that have gotten an infection they thought was just, a couple of days, and then Months later, they start having these weird things, joint pains, right? Rashes happening, all kinds of things. Those are delayed responses. So to end this, or to conclude this, what you should actually fear and what you shouldn't is what's important from this, okay? So, Dr. Keisha, now I'm really scared. Like, now I can get cancer. No, that's not what I want you to fear. I want you to understand context matters. Not every virus is catastrophic, right? Most exposures do not become severe disease. They don't. Public health measures matter. So what we need to fear is our response in our human behavior. We need to take more action. We need to be proactive and we need to be vocal. Vaccines matter. We need to be sharing that. Surveillance matters. We need to be sharing that. And immune status matters. You need to know your risk assessment, which is important. You also need to know when your risk assessment is the same as the other person because you have a hantavirus that has a 50% mortality rate, right? You need to look at things like wastewater surveillance in your area. Look at the local health department. How much wastewater surveillance is happening in your area? What is zoonotic spillover? And that's what's happening with hantavirus. Something that happens normally in rodents or bird flu is now affecting humans. And that happens because of human behavior, which leads to climate change, which leads to these things. So we actually are putting a hand to this. We're adding to the pot. We're adding to the pot that we shouldn't be wanting to add to. Fear without understanding creates panic. I don't have fear without understanding. I have fear with knowledge, but I also have I still have a sense of calm around me. And I also believe in the scientists that I know that everything can be okay. Now, what I also do fear is that you cannot control everybody. You cannot control all of the misinformation. And if someone chooses not to vaccinate their kids and they are alive, it's beyond your control. You can do what you can. That's one thing we have to learn to do, is to walk away and realize when we cannot reach everybody. But we do not want to invoke fear in the people around us, right? So make sure we're sharing stuff with context. Don't go around here saying, listen to this episode with Dr. Keisha where she talked about viruses causing cancer without context, right? So viruses are incredibly diverse. They're here to stay, you all. They're here to stay. Some are mild, some are deadly, some trigger inflammation, and some can hide for years. Some contribute to cancer, and some teach us just how interconnected that public health, pathology, immunity, and human behavior really are. And understanding that complexity is one of the most important parts of protecting ourselves and each other. So I implore you all to read a little bit about this, look at the show notes, share this episode with somebody that you care about or you want to know about this. And thank you all. Have a great evening. Have a great day. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.